Now, away from the gold board, a confirmed outbreak of H1N1 has struck Anum Senior High School, with all 9 samples from the school testing positive at the Noguchi Memorial Institute for Medical Research. Furthermore, suspected cases have emerged at Bosu Secondary Technical School, where additional samples have been collected. Now awaiting confirmation, health authorities are monitoring the situation closely and have urged the public to remain vigilant. Now let's go on Zoom and engage the H1N1 District Director of Health Service, Madam Rebecca Bante. Thank you for joining us, Madam. Let's get understanding what exactly this H1N1 is, first of all. Well, we don't have the health director yet, but if we do, we'll definitely get to know and understand exactly what this outbreak is. But let's bring in the District Chief Executive of H1N1, Godwin Bobobi. I hope that I got the name very correctly. Thank you for joining us. So what's the situation really in your district? Mr. Bobobi, if you can unmute.
Oh, okay. Am I live?
Yes,
now?
you are. Thank you.
Oh, okay. Okay. So, good afternoon to you. As you rightly said, we have a confirmed case of influenza. As the health people who put it, it's a H1N1 outbreak in Anum Senior High School. Somewhere last week, 25 samples were taken to Noguchi for testing, and 9 confirmed positive to have contracted the virus. As we speak, they are in isolation centers. Some are in the health center as well. And then you go to Bosu Secondary Technical. Samples have been taken from 44 students because they were also showing symptoms of the virus, coughing, fever, and all that. So 44 samples were taken and sent to Noguchi as well. We yet to have the results from the test of those samples. But let me say that we are safe and sound. Our health system here in the district is in safe hands. The district health directorates, to region, to national, they've responded so swiftly, and we've been able to mobilize the needed PPEs, the face masks, hand sanitizers, paper tissues, and Veronica buckets. And so just to make sure that they are observing the highest standards of hygiene, hand washing, and the rest. So far, there's no reported case in the communities yet.
Okay.
The health authorities have activated their surveillance protocols in order that they can pick up such cases if it should happen in the communities. They are insisting that the students be isolated, and that parents should not panic to come for their children, in order that they don't send the virus to the communities. So far, everything is under control.
Will you describe it as an outbreak yet?
That description came from the health authorities.
Okay.
But as they said, it's just a mild situation, and that it is not something that we should panic about. And that per their protocols, even if it should be one positive case, it will still be described as an outbreak.
Okay. I mean, you mentioned that the students who tested positive are in isolation, and this is under the care of the health providers, or they are isolating by themselves?
No, but under the care of health providers.
Okay. I mean, also...
we go to Anum. I was at Anum yesterday, and then Bosu Secondary Technical. We have isolation centers. 3 rooms have been designated as isolation centers in each of these schools to manage the cases.
Okay. And so you say that the situation is under control. You also mentioned that PPEs and all the things that the health personnel will need you have provided so far.
Exactly.
Right.
We only urging that the students who adhere to the safety protocols, like putting on the face masks, washing their hands, sanitizing their hands, not going home. You know, some may want to go home. Students, some may want to go home because of this situation. But what the health people are saying is that if you are able to contain the situation in the schools for the next 2 weeks, if you're able to put on the mask and observe all the other protocols, yes, after 2 weeks, the virus naturally, dies off.
Right.
So that we all come back to normalcy.
Right. Thank you. Thank you so much, Mr. Bobobie, for joining.